Okay, so chapter 14 is about research in dental hygiene. This is going to be a review for you for that last course. Learning objectives will be to explain the purpose of dental hygiene research, describe the role of research in dental hygiene, discuss the use of evidence-based practice in dental hygiene, explain the connection between research and private practice, and describe the role of research in professional development. So after you finish this chapter, you should be able to use evidence-based decision-making to evaluate emerging technology and treatment modalities to integrate into patient dental hygiene care plans to achieve high-quality, cost-effective care. You'll be able to assume responsibility for professional actions and care based on accepted scientific theories, research, and the accepted standard of care. Be able to continuously perform self-assessment for lifelong learning and professional growth, integrate accepted scientific theories and research into educational, preventive, and therapeutic oral health services, and to pursue career opportunities within healthcare, industry, education, research, and other roles as they evolve for the dental hygienist. So, why are we doing this, right? Conducting research is necessary to develop new programs and evaluate existing programs in dental public health. Dental public health is seeking to prevent or control disease through those evidence based programs, but we need them to be cost effective to administer. So, we need to do research in order to develop those new programs that meet the criteria in order to work effectively, but also to be cost effective. And then we have to accurately interpret the information that we're getting back. We need to be able to evaluate those programs and to be able to determine are they working for what they're supposed to be doing, right? Dental hygienists need to be able to conduct research and we need to be able to collect that data and then evaluate that data of those treatment modalities and of products. And so even though we're not working necessarily in research by, specifically, every single thing we do in private practice is still, applying research concepts and, gathering data in looking at your patient and evaluating your patient, and then evaluating its effectiveness of, the products or the treatments. So conducting research can often seem distant and unrelated to the practitioner's daily concerns, but practice is a lot the same of research. So this table is on page 181 in your book, and it compares private practice methodology to research methodology, right? So your patient has a chief complaint. In research, you're collecting data like surveys or making observations about your population. In private practice, you would take down a health history, right? But in research, you might conduct a literature review. And then private practice, you would make a diagnosis, or the dentist makes the diagnosis. And then in research, you're developing the research question or the hypothesis. You're making a guess as to what you think it is, right? Based on the information that you have. And then in private practice, you would determine a treatment plan. But in research, you would write a research proposal. And then private practice, you would obtain informed consent for that treatment. And in research, you would still obtain informed consent, but you'd also have to get funding, right? In private practice, you would then provide the treatment, whatever that treatment intervention is, SCRP or Prophy or whatever it is, you would perform that treatment. In research, you would conduct the research study. You would go through all the things you said you were going to do. And then in private practice, you would bring them back and you would do a recall or a reevaluation, right? And then in research, that's where you analyze all of the data as you were conducting the research, all of the data that you collected. That's when you analyze it and you interpret it, and then you publish your results. Okay, so to accurately interpret research, to be able to understand what you're reading, the hygienist has to understand basic research principles, right? That's where the different methodologies come into play. And understanding how research studies were conducted, it gives us more information about the type of conclusion that the research came to, right? So just like we know that a treatment plan might be effective, or it might have worked in the research study, we know that the research study might not have been conducted 100% perfect, or we know that there might be some bias in that research study. And so therefore, we don't think, oh, yes, this is 100% perfect. It's going to work all of the time. We're still, somewhat skeptical. And that's important for us to have. It's important for us to understand how the research is conducted or how research should be conducted in order to compare it to what we're reading. And then we know whether or not it's a good treatment or it's a good product, or, whatever is actually, whatever it's saying actually is what it's saying. And so then dental hygiene is based on research and the results that that research gives us, both, in our treatment, because all of our treatment is actually based on evidence-based, treatment it's been conducted in the past. It's either worked in the past or it hasn't worked in the past. And so, when things don't work, you tend to abandon them, right, for the better way of doing things. And so, um, that's where that cycle of evidence-based practice comes from. You're not just taking evidence and things that have been studied, but you're also taking information from your patients and you're comparing it to that information. Okay, so the study of disease in populations is accomplished by conducting research using the scientific method, which is a body of techniques using observation, reason, and experimentation to gather empirical and measurable data. Um, the accuracy of the research determines the usefulness of the information obtained and conclusions that can be drawn. So, good research is the foundation for understanding why disease occurs and how to prevent and control disease. So then evidence-based practice, it means that there is a requirement or the concept of evidence-based practice and of using that evidence-based dental hygiene. It means that students can actually be taught the practice of dental hygiene based on independent research done by practitioners and scientists as reported in peer-reviewed health-related and dental hygiene research, or I'm sorry, journals. Therefore, it kind of takes away the concept of having to have someone who already knows all of the answers, right? People who know a lot aren't necessarily the ones who are out talking all the time, right? What if they're not someone who does public speaking or gives continuing education or becomes an educator? So this is where things really transition from. It's not about finding a mentor. You should find a mentor, but it's not about finding someone who knows everything. It's about you being able to find the answer without having to go through a person who kind of holds that information. This gives the power back to students and it lets them kind of take control of how much or how little that they decide to learn. This is on page 182 in your book. This is that sort of little Venn diagram of where you want to be. So evidence-based practice is this little triangle here in the middle. We understand the evidence because we read the scientific literature. We have clinical experience. All of you, even though it might not feel like you have a lot of it, you have come in contact with your patients. You understand, how to perform specific treatments, right? And then we have our patients' preferences as well because they have to have autonomy in their decisions, right? And so this perfect little storm where we get both the evidence and the clinical experience based on our understanding of things, and we come into contact with the patient's preferences, that is where we want to live. We want to be in this triangle in the middle where we're using the best we're using the evidence that we know. We're using our experience to the best of our ability, and we're taking that patient's preferences into consideration. That is where we want to practice. So then that concept before, where, dental hygienists who graduated several decades ago, 20, 30, even 40 years ago, they're a lot less likely to have been using the evidence-based practices that we know and love today, right? They're more likely to base their practices on what their instructors had told them at the time, which is trial and error treatments, right? Everybody's doing trial and error. If you think you're not doing trial and error, you're also doing it, okay? But they were learning from instructors who had already done trial and error, one of those, learn from my mistakes sort of way of doing things. They were getting anecdotal reports of successful periodontal treatment. And anecdotal information is good, especially when you're getting it from, instructor who's been practicing for a long time. But without the research behind that anecdotal report, we don't necessarily know that the treatment that was given is exactly what helped. It could have been something else that that office was doing that was actually what worked. So because, it worked for them doesn't necessarily mean it's going to work for everyone. That's where that reproducibility comes from in our research. And then also the selection of oral care products because of advertising. You guys just finished that whole concept. So just because it advertises well doesn't necessarily mean that the product is a good product, right? And just because they're paying hygienists or they're paying 4 out of 5 dentists to say that the product is good doesn't mean the product is good. It doesn't mean it works. And even if the research study that was conducted by the company that is trying to sell it to us, if it comes from the person trying to sell us something, we can't always believe what they have to say. We have to find research that is done by people who aren't being paid to give you an answer. We need to find research from people who don't have stake in whether you buy that product or not. People who are doing the research simply to find out, does it actually work? Is it really worth it? Those are the people you want to listen to. So, an example of that change from the non-evidence based dentistry to now, it starts on page 182 in your book and it finishes on 183. But it used to talk about the fact that there was a concept that in order for in order for fluoride to be fully absorbed, we had to first remove plaque, as if the plaque was somehow causing a barrier for the fluoride to be absorbed, right? But they conducted a research study to find out if the fluoride was being conducted based on the presence of biofilm or not. And they found that no, biofilm actually does not interfere with the penetration of fluoride into the tooth structure. So that's a concept there that we don't necessarily have to clean someone's teeth before we can put fluoride on their teeth, right? This would change the fact that, there are public health initiatives where they go to schools and they put fluoride on people's teeth. If we were still practicing without the evidence-based dentistry, we would assume first we need to polish those children's teeth before we put the fluoride on, which would be very time consuming. It would require a lot more, in order to do that kind of school-based program versus just going to their teeth and applying fluoride right over the plaque, knowing that it doesn't affect the absorption and moving on, and so this is I don't know about you guys, but those kinds of things give me goosebumps. Like it's amazing to think about, just because we've been doing something um for a long time doesn't mean it's the best way to do it. Oh, the book, you know how it does these little did you knows? I love these little did you knows. So there's this the only slide where it talks about one of the did you knows, but I like all of them. So the one that's on 183 says dental hygienists need to conduct dental hygiene research to validate current methods of practice and to investigate new ones. So this is really wonderful. It's what we're just talking about. The fact that just because it's always been done a certain way, if there isn't any research to support it, guess what? We need to study it. And then the one on page 184, the first one, anyway, there's two, it talks about the terminal degree. So in a terminal degree means the highest degree that's available in a discipline, in a specific, field of study, right? And so in most disciplines, this is a doctoral degree. However, in dental hygiene, the master's degree is the terminal degree because you cannot get a PhD in dental hygiene, right? You can only get a master's degree in dental hygiene, um, and so they're talking about now, I guess Idaho State University is currently in the process of developing a doctoral degree program in dental hygiene. A lot of the dental hygienists that you find that have masters in dental hygiene, but that want to get a PhD, we have to find a related field of study. Right now, kind of public health and um, health studies are the closest sort of thing to dental hygiene because dental hygiene is very firmly rooted in public health. But you hopefully by the time you guys decide to get a PhD, there will be a dental hygiene PhD. Anyway, and then this one I think is this bottom one. It says if a dental hygiene is to evolve as a specific scientific discipline, a research base solely generated by the profession must be established. It looks like the slide has decided to to say that differently. But I firmly believe that. I think that if we want to be taken seriously as providers, if we want to be taken seriously as health professionals, then we need to get on board with everybody else and conduct our own research and embrace it. We need to embrace the responsibility that comes along with being a healthcare provider and not rely on the dentist to carry the responsibility for us. If we want to practice dental hygiene, we want to be recognized in this way, then we need to stand up for ourselves and we need to do the work that is required of that. So then the role of research in dental hygiene. This talks about the cornerstone of the profession. It's basically what tells every state after, Alfred C. Phones, the dentist who is the founder of dental hygiene. He trains a couple of dental hygienists. He opens his school in Bridgeport, and he studies the effectiveness of dental hygiene. So he creates a class of dental hygienists, and then he puts them to work, and then he studies the what they're able to do and how effective it is, and that is why we have dental hygienists today. We often think of it being like it's a good thing, but how do we know it was a good thing? He didn't know that dental hygiene was going to be effective. He didn't know we were going to do good things in the world of prevention until he did it. He applied a dental hygienist. He trained one, and then looked at how much good could be done based on that, and that's a study. So he does this study, and he begins the first documented study on the impact of dental hygienists on school children. So the first school-based dental clinic it opens up in 1914, and the research results yielded by the practice were published in 1921. So he begins, it looks like it's a 7-year study, and women get the right to vote around this time too. So that if you need some historical context there, and he basically finds that the data finds that there is a reduction of 34% of dental decay on the children who were being seen by dental hygienists, which of course is huge. At the time, I think it was 97% of children. Of the children studied had some form of dental decay, and so there was definitely a need. Of course, they would have done a needs assessment, and then they found that dental hygienists could significantly reduce this. And also, in their studies, they found that children were consuming a lot of sugar, which is how they found that sugar leads to dental decay. And so, I think it's really amazing. The beginning of dental hygiene is really rooted in research studies and those programs and, evaluating how effective they were. Okay, so Dr. Alfred C. Phones, he conducts his study, which is nice. And then in 1926, there is an article published in the Journal of the American Dental Hygienists Association, which of course now is called the Journal of Dental Hygiene, which presents information on research that documented the effectiveness of dental hygiene. So our entire profession is based on this 1926 article that tells the world, but also, just the United States, whoever was reading the Journal of Dental Hygiene, that we matter, that we can make a difference, right? And then, so research becomes routine in dental hygiene at that point, and the graduate programs begin, so, the master's program comes around in the 1960s. And then the ADHA's Committee on Research actually begins in the 1970s, which of course now is a really wonderful program. If you're ever interested in getting involved in research, the ADHA has a lot of information. So the ADHA Foundation, which is now called the ADHA Institute of Oral Health, or IOH. It's something that all of the components raise money for every year in order to fund those research studies that dental hygienists are conducting. It's amazing. So the research shouldn't just tell us, the best way to sit while we provide dental hygiene services, right? We're not just, researching ergonomics or the happiness of dental hygienists. research should first and foremost be rooted in the public's oral health. Okay, so our research should be, well, the profession of dental hygiene should be to improve the oral health, and so then the research we do should be determining whether or not we are improving the public's oral health. And so the research there should be to advance and promote the profession of dental hygiene. Okay, so on 185 is box 14-2. This is the definition of a scholarly identity. So here it has a sense of the dental hygiene discipline as a whole, has a lifelong commitment to the development of dental hygiene disciplines knowledge base by asking and answering research questions central to the discipline. So it needs to be revolved around dental hygiene. We need to use evidence to support one's viewpoint always. We need to consider the related work of other dental hygiene scholars as well as that of other disciplines. So when we are conducting research in dental hygiene, we need to be writing literature reviews based on the current scholarly literature that is already present. We need to report one's own results in the context of those of others in the field and beyond. So when we state our results, we need to say, we knew this, so we studied it, we found this in comparison to what was already existing, or is this data, does the data support what already existed, or does it contradict what is already existing? And we need to be able to make a plan for further studies. So, you guys have been reading studies lately, so you know that in a lot of research studies, it talks about, there's not enough research in this area and we need more. We need to find this answer. So a lot of research studies, they have their research question and they answer their research question based on their data, but a lot of them also will pose, that further work that still needs to be done. It also will disseminate the findings of one's work through scientific publication. And this is important because, we're not just writing blogs. We're not just, writing, an article here and there. We are publishing it through scientific publication where it gets peer reviewed and we are held accountable for the information that we are publishing, because that is how it gets credibility, and that is how that information is then used by others. If we want others to be able to look at our research and find it credible and to, replicate our studies in order to determine the reliability, then we need to publish it the way that it's supposed to be published. This is, again, we just need to do the work that is involved in picking our profession up, standing up for ourselves, and moving forward as oral health healthcare professionals. Okay, so right now, dental hygiene is being described two different ways. We're being described as a developing discipline, which is a good thing, and we're also being described as a field of study by other people. A field of study is like a subdiscipline or an area of emphasis within the larger context of a discipline. So right now, some people see dental hygiene as their own discipline, and others see dental hygiene as a subdiscipline of dentistry, right? In order for us to be considered our own discipline, we need to have these three things: theoretical body of knowledge. So we need to conduct our own research in theory. Okay, not like we're pretending to study research. We need to study research. Then that gives us the body of theoretical knowledge, and then we need to have a relevance to societal need and demand. I think we can all agree that there is certainly a need for dental hygiene preventative services out there in the world, right? But we need a demand. Okay, and then educated by masters in the field. This just basically means that you go to school and learn by dental hygienists who, have been taught by other dental hygienists. So there is a ongoing process of, I learn from my instructors. I go, out into the world and I learn as much as I can beyond what my instructors taught me. And then I come back around and teach students not only the information that I got from my instructors, but also the information that I learned. And then I give that information to them, and then they go on and, they take what I've given them, and then they also learn more. That's how that works. We all are basically giving as much as we possibly can to students, and then they pick up where we leave off and they continue to learn from there, and then they teach whomever else that much more. Okay, so the occupational versus professional model. This is a concept in dental hygiene that I think that we sometimes forget about, especially working here in the state of Texas, where we don't have quite as wide scope of practice as we should have. And so I think many of us kind of get pushed into an occupational role versus a professional role. But basically, the difference between these two is the how the dental hygienist is functioning, their thought processes behind the services that they provide. It addresses the responsibility of the dental hygienist to themselves, to the patient, and to other professionals. And then it also provides potential solutions to oral health care issues. So let's talk about that. The occupational model, which is a concept given to us by Darby and Walsh, um, is a conceptual model based on technical competence. Okay. And so in this one, the dental hygienist focuses mechanical abilities on disease management, which is defined and delegated by the supervising dentist. Basically, we provide procedural care, which is routine, uncomplicated, and considered trivial. We go through our recall appointments and they're very predictable. Our perspectives toward the patient are paternalistic because the dentist is responsible for oral health care outcomes. It basically, we are going through the motions. We're doing what we're told, and we're not. We're professionals. We are providing services that we're licensed and trained to do, but we're not making the decisions, and we are doing what we are told to do. Then we have the professional model, which is the opposite of that. So it's grounded in the belief that everything a dental hygienist does is derived from a solid scientific research base. This is the model where dental hygienists are, um, I mean, we're thinking for ourselves. It's essentially we are evaluating our patients, and we are applying that evaluation of our patient to our body of knowledge, which is it should be extensive, and we are then coming up with our own thought processes for what should be done, which treatments we should be providing. And so in this one, the process of care system seeks the overall wellness of the patient. We're not just looking at, I'm giving them a prophy versus a perio maintenance. We are looking to improve their life by, within our scope of practice. And it takes a very proactive risk assessment and prevention strategy instead of reactive disease approach. This one is very important because it's the difference between a dental hygienist who is going to spend their whole life doing what the dentist tells them to do versus the dental hygienist who is pushing to be able to diagnose, and be held responsible for those diagnoses. Um, and I think that, you're going to be one of these. Every hygienist is. And you can go back and forth as many times as you need to, but at any given day, at any given time, every single patient you see, you're practicing one of these things. Either you're going through the motions and you're doing what you're told and you're not really pushing the envelope, or you are actively engaged in that patient's care. So this is just basically going through the same things I talked about. This first one, technical competency, is occupational model. It's where the dental hygienist is just mechanical abilities. We have the ability to scrape teeth. The delegation by the supervising dentist, we are doing what we are told, and there is no ownership of care provided. Now, there are certainly pros to following the occupational model, right? We don't want the responsibility. If we diagnose incorrectly, or we make claims and the patient is upset about that and they try to sue us, then we don't necessarily want the responsibility of them being able to sue us, right? But if we do that, then we also don't get the responsibility of making decisions. So in the professional model, we are basing our decisions on solid scientific knowledge base, and we do this by the evidence-based practice, the triangle we talked about. And then in this one, the dental hygienist is a critical thinker, and we are problem solving. So you're seeing something, and you're asking questions, and you are investigating to the fullest extent, and you are, actively engaged in your patient's care. And then in this one, the dental hygienist has to assume responsibility for the care that is provided. So in this one, yes, there is more risk, but I'm a firm believer that where there's risk, there is reward. So this goes along with the professional model as dental hygienists. If we are, kind of following the professional model, then we're going to be in this little loop here. And so we're educated, obviously, and we're going to be providing the best care that we can based on our evidence-based practice, right? And then we're going to run into something that we don't know. So then the knowledge of the research principles, we're probably going to have, some research questions. We'll go look up things up. We've talked about open access and all of that wonderful stuff. So we're gonna be doing some research principles in order to learn about things. And then there's going to be some unanswered questions, and we're going to do research based on that unanswered those questions that we don't know. And so the research base promotes critical thinking and problem solving abilities. And we're going to, maybe conduct some research, or we'll do, some our own research in the office, as we talked about, which is very similar to private practice care. And that's going to make us that much more educated, and we're going to be providing that much better of care. All right, so that's it for chapter 14. But the end is that you, no matter whether you're actually in research, or you're working in private practice, or you're in education, or you go into sales, you need to be familiar with those basic research principles. I'll be very sad if you go out in the world and you forget everything we talked about. And then you need to be understanding and using those tools, especially those research tools that I am so pushing. And you need to be able to use those tools to help dental professionals incorporate that evidence-based dentistry into their daily practice. And so it's not just you, it's the other hygienists in your office, it's the dentist in your office. I've talked to you guys about how, when my dentist was talking about a certain toothpaste, and he was saying something about the abrasivity of the toothpaste, I went and looked it up, and I found a research study that compared all of the abrasivities of the different toothpastes, and it turned out the one the patient was using was actually really low. So the reason for that patient's abfractions wasn't because of their toothpaste, and we shouldn't switch their toothpaste if they liked it. It was because of their habits. And so I hope that you take some of those research concepts with you out into your private practice. And when you don't know something, I hope you look it up, and I hope you look for a source that is credible and non-biased. And I hope you then take that information and apply it to your practice, and to tell others about whatever it is you found, because it's very valuable.